consideration of usefulness of leakage prevention system for critical diagnostic information transmission. In recent years, overlooking and failing to communicate the result of the imaging and pathological examinations to patients has become a major problem in Japan. The following factors are thought to be responsible for overlooking or failing to communicate the result of imaging and pathology examinations to patients. First, forgetting to check the result report. Second, partial oversight of result reports. Third, forgetting to communicate diagnostic result to patients. The Japan Council for Quality Healthcare has issued similar warnings. A few similar cases have been reported in our hospital. This slide shows a case of forgetting to check the pathological diagnosis report. This slide shows a case of inadequate check concerning diagnostic imaging reports. We have shown the purpose of this study on the slide. In order to prevent these oversights and omissions, we have jointly developed the new system with a system vendor. It's called Asahikawa Medical University Information Rescue, AIR, and we began clinical use in December 2019. In this study, we reported the effect of introducing and the usefulness of this AIR system. This slide shows an overview of the AIR system. The AIR system was built using a generic DWH data warehouse. Exam orders registered in the HIS are linked to each departmental system, and order information is also linked to AIR system. After the examination is completed, the generated result report is registered in the EMR electronic medical record, and the information registered in the HIS is linked to AIR with important information. AIR system notifies the ordering physicians group of the status information of each relevant report when the physician logs into the EMR. Based on the information linked from the HIS and the respective department system. In addition, the status information of each report related to the patient is notified when the patient's chart is deployed. This notification will be repeated until the status is explained. Physicians can directly view the patient medical record and each report from the status information notification, and change the status sequentially according to the action taken, such as confirming the contents. The administrator of each department checks the report with the explained status on the EMR from the status list screen. Confirm that the explanation has been given to the patient and changed to the status to approval. The approval status can be registered only by the administrator. We have shown the basic concept of the system development on the slide. And the very important point is the system must function as an independent system. And the system should be relatively flexible in terms of who is notified. We have shown the method on the slide. The target data for this study were the diagnostic imaging reports and pathological diagnosis reports registered in our system, and the period was from December 2019 to June 2020, when the system became fully operational for all departments. Our system uses 4 different stages to manage the confirmation and communication status of each report. We have shown the description of each status on the slide. First, unread. The report has not been read yet. Second, read. The report was confirmed, but no explanation given to patient. Third, explained. Examination results were explained to the patient. Fourth, approval. The department's management has reviewed the record. The slide shows a graph of the pathological diagnosis reports for each status period. The slide shows a graph of the diagnostic imaging reports for each status period. The unread ratio of reports and the mean time to explanation were greatly improved. Report with important flags improved month by month. Report without important flags were improved. However, especially imaging reading reports, which were many unread and biased by department. We have shown discussion on the slide. With the implementation of the system, we no longer need to extract targets like paper list. The duration of unread report and the status of results. Communication improved significantly. This system can be useful. However, since there are many reports that are not yet supported, especially for non-important reports, human intervention as well as system are considered necessary. In our hospital, the Medical Safety Management Department checks the status once a month and requests the department to take action on unread or unexplained reports. However, some people say that this is too much work. We are constantly improving our system to make it as easy as possible. We have shown conclusion on the slide. In recent years, overlooking or failing to communicate the test result of imaging and pathological examination to patients has become a major problem in Japan because of its impact on the prognosis of patients. In order to prevent report from being overlooked or miscommunicated, we have jointly developed a system to prevent miscommunication of important information, which has been in clinical use since December 2019. Our system has greatly improved the confirmation and communication of reports, and this system is useful. However, since there are some reports that are not yet handled even after the system is notified, it was thought that the human intervention as well as the system is necessary. In addition, we are continuously improving the system to reduce the workload of doctors as much as possible. The slides are for reference. Thank you for your attention.